And now Robert F. Kennedy Jr.'s hearing has just got underway at the U.S. Senate. Let's listen to a little of the grilling there.
President Trump nominated him this year to be in November of 2024 to be the HHS secretary. In announcing his nomination, President Trump stated, "Mr. Kennedy will restore these agencies to the traditions of gold standard scientific research and beacons of transparency and end the chronic disease epidemic and make America great and healthy again." Before you give your opening statement, Mr. Kennedy, I have 4 obligatory questions that we ask all nominees before this committee. First, is there anything that you are aware of in your background that might present a conflict of interest with the duties of the office to which you have been nominated?
All right. No, Mr. Chairman.
Thank you. Do you know of any reason, personal or otherwise, that would in any way prevent you from fully and honorably discharging the responsibilities of the office to which you have been nominated?
No, I do not.
Do you agree without reservation to respond to any reasonable summons to appear and testify before any duly constituted committee of Congress if you are confirmed?
Yes, I do.
And finally, do you commit to providing a prompt response in writing to any questions addressed to you by any senator of this committee?
Yes, I do.
Thank you, Mr. Kennedy. And before you begin, if you would like to, you may introduce your wife and children.
Yes. My wife, Cheryl Hines, is here. My daughter, Kit Kennedy, my son, Bobby Kennedy, his wife, Amaryllis Fox Kennedy, and my nephew, Jackson Hines, is here, too.
We welcome you all. Thank you. You may proceed with your statement.
Thank you, Mr. Chairman. Chairman Crapo, Ranking Member Wyden, and members of this distinguished committee, I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again. I also want to thank Cheryl and Kik and Bobby and all of my other children who are here today and all the many members of my large extended family for the love that they have so generously shared. Ours has always been a family that has been involved in public service, and I look forward to continuing that tradition. My journey into the issue of health began with my career as an environmental attorney, working with hunters and fishermen and mothers in the small town in the Hudson Valley and along the Hudson River. I learned very early on that human health and environmental injuries are intertwined. The same chemicals that kill fish make people sick also. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. Autoimmune diseases, neurodevelopmental disorders, Alzheimer's, asthma, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise, some of them exponentially. The United States has worse health than any other developed nation, yet we spend more on health care, at least double, and in some cases triple, as other countries. Last year, we spent $4.8 trillion, not counting the indirect costs of missed work. That's almost a fifth of GDP. It's tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for health and have better outcomes and a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to restore America's global strength and to restore the American dream, but he understands we can't be a strong nation when our people are so sick. A healthy person has 1,000 dreams. A sick person has only one. Today, over half of our countrymen and women are chronically ill. When I met with President Trump last summer, I discovered that he is more than just concerned for this tragic situation, but genuine care. President Trump is committed to restoring the American dream, and 77 million Americans delivered a mandate to him to do just that, due in part to the embrace and elevation of the Make America Healthy Again movement. This movement, led largely by Maha moms from every state, you can see many of them behind us today, and in the hallways and in the lobbies, is one of the most transcendent and powerful movements I've ever seen. I promise President Trump that if confirmed, I will do everything in my power to put the health of Americans back on track. And I've been greatly heartened to discover a deep level of care among members of this committee, too, both Democrats and Republicans. I came away from our conversations confident that we can put aside our divisions for the sake of a healthier America. For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20%, there are no good options, only bad ones. Shifting the burden around between government and corporations and insurers and providers and families is like rearranging deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change the course and ask, why are healthcare costs so high in the first place? The obvious answer is chronic disease. The CDC says 90% of healthcare spending goes toward managing chronic disease, which hits lower income Americans the hardest. The president's pledge is not to make some Americans healthy again, but to make all of our people healthy again. There is no single culprit in chronic disease. Much as I have criticized certain industries and agencies, President Trump and I understand that most of their scientists and experts genuinely care about American health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal. Before I conclude, I want to make sure the committee is clear about a few things. News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety.
We'll have order. Please proceed, Mr. Kennedy.
I am pro-safety. I worked for years to raise awareness about the mercury and toxic chemicals in fish, and nobody called me anti-fish. And I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. My first book in 2014, the first line of it is, I am not anti-vaccine, and the last line is, I am not anti-vaccine. Nor am I the enemy of food producers. American farms are the bedrock of our culture, of our politics, of our national security. I was a 4-H kid, and I spent my summer working on ranches. I went to work with our farmers. I want to work with our farmers and food producers to remove burdensome regulations and unleash American ingenuity. MAHA simply cannot succeed without a partnership, a full partnership of American farmers. In my advocacy, I've often disturbed the status quo by asking uncomfortable questions. Well, I'm not going to apologize for that. We have massive health problems in this country that we must face honestly. And the first thing I've done every morning for the past 20 years is to get on my knees and pray to God that he would put me in a position to end the chronic disease epidemic and to help America's children. That's why I'm so grateful to President Trump for the opportunity to sit before you today and seek your support and partnership in this endeavor. I will conclude with a promise. the members of this committee, to the president, and to all the tens of millions of parents across America, especially the moms, who have propelled this issue to center stage. Should I be so privileged as to be confirmed, we will make sure our tax dollars support healthy foods. We will scrutinize the chemical additives in our food supply. We will remove financial conflicts of interest from our agencies. We will create an honest, unbiased, gold standard science at HHS, accountable to the president, to Congress, and to the American people. We will reverse the chronic disease epidemic and put the nation back on the road to good health. Thank you.
Thank you, Mr. Kennedy. Mr. Kennedy, I will begin. Each of us will have 5 minutes to ask you questions, and then at the conclusion of the hearing, if there are further questions, there will be an opportunity for those questions to be submitted to you, and I ask that you respond to them promptly. Mr. Kennedy, you have emphasized the importance of nutrition in preventing and managing chronic disease, improving health outcomes, and reducing health costs. I share your interest in the relationship between our diet and our well-being. And if confirmed, I look forward to partnering with you on those efforts. Would you share with the committee why you are passionate about the nutrition-oriented disease prevention and what you have learned?
Yes, Mr. Chairman. I had 11 brothers and sisters. I had dozens of first cousins. I was raised in a time where we did not have a chronic disease epidemic. When my uncle was president, 2% of American kids had chronic disease. Today, 66% have chronic disease. We spend zero on chronic disease during the Kennedy administration. Today, we spend $4.3 trillion a year. With 77% of our kids cannot qualify for military service. When I was a kid, the typical pediatrician would see one case of diabetes in his or her lifetime, 40 or 50-year career. Today, 1 out of every 3 kids who walks through her office door is diabetic or pre-diabetic. And the most recent data from NIH shows 38% of teens are diabetic or pre-diabetic. Autism rates have gone from 1 in 10,000 to 1 in 1,500, depending on what studies you look at. In my generation today, 70-year-old men, 1 in 34 in my kids' generation. We've seen this explosion of autoimmune disease, of allergic diseases. This is not just an economic issue. It's not just a national security issue. It is a spiritual issue, and it is a moral issue. We cannot live up to our role as an exemplary nation, as a moral authority around the world, and we're writing off an entire generation of kids.
Thank you very much. And if confirmed, how could we work together to integrate nutrition-based interventions into our healthcare programs like Medicaid and Medicare?
Well, there are many ways that we can do that. The federal funding of the SNAP program, for example, and of school lunch programs could be a driver for helping kids. We shouldn't be giving 60% of the kids in school processed food that is making them sick. We shouldn't be spending 10% of the SNAP program on sugar drinks. So we have a direct ability to change things there. We also, in Medicaid and Medicare, we need to focus more on outcome-based medicine, on putting people in charge of their own health care, of making them accountable for their own health care so they understand the relationship between eating and getting sick. Most importantly, we need to deploy NIH and FDA to doing the research to understand the relationship between these different food additives and chronic disease so that Americans understand it and make sure that Americans are aware of it. I don't want to take food away from anybody. If you like a McDonald's cheeseburger, or Diet Coke, which my boss loves, and you should be able to get them. If you want to eat Hostess Twinkies, you should be able to do that. But you should know what the impacts are on your family and on your health.
Thank you. Senator Wyden.
Thank you very much, Mr. Chairman. Before I begin my questions, I'd like to start by entering into the record a letter the committee received from Ambassador Carolyn Kennedy outlining what she believes is Mr. Kennedy's lack of personal fitness for the office.
Without objection.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines. You say one thing and then you say another. In your testimony today under oath, you denied that you were anti-vaccine. But during a podcast interview in July of 2023, you said, quote, "No vaccine is safe and effective." In your testimony today, in order to prove you're not anti-vax, you note that all your kids are vaccinated. But in a podcast in 2020, you said, and I quote, "You would do anything, pay anything to go back in time and not vaccinate your kids." Mr. Kennedy, all of these things cannot be true. So, are you lying to Congress today when you say you are pro-vaccine? Or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast and will see this, he asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective, and I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
All right, so
he interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden, so bringing this up right now is dishonest.
let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021, you petitioned the Food and Drug Administration to not only block Americans from having access to the COVID vaccine, but to prevent any future access to the life-saving vaccine. Are you denying that? Your name is on the petition.
We brought that petition after CDC recommended the COVID vaccine without any scientific basis for 6-year-old children. Most experts agree today, even the people who did it back then, that COVID vaccines are inappropriate for 6-year-old children who basically have a zero risk from COVID. That's why I brought that lawsuit. I don't want to. I want to emphasize
Mr. Kennedy, the facts.
The committee will be in order. And to the audience.
Senator, I'm not against vaccine.
If you'll hold off for a second, Mr. Kennedy. To the audience. Comments from the audience are inappropriate and out of order. And if there are any further disruptions, the committee will recess until the police can restore order. Please follow the rules of the committee. Mr. Kennedy, you may proceed.
I also want to point out that your recitation of what happened in Samoa is absolutely wrong, and you know it's wrong.
We'll get to that in a moment. Right now, we're talking about the petition that you filed to block Americans from having access to the vaccine and to prevent any future access to the vaccine. Those facts are on the record. My third question to you is, you made almost $5 million from book deals, mostly promoting junk science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective. The reality is measles are, in fact, deadly and highly contagious, something that you should have learned after your lies contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
The death rate from measles historically in this country in 1963, the year before the introduction of the vaccine, was 1 in 10,000. Let me explain what happened in Samoa. In Samoa in 2017 or 2015, there were 2 kids who died following the MMR vaccine. And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s, so they've never been very high. And in 2018, 2 more kids died following the MMR vaccine, and the government of Samoa banned the MMR vaccine. I arrived a year later when vaccination rates were already below any previous level. I went there, nothing to do with vaccines. I went there to introduce a medical informatics system that would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019. The measles outbreak started in August. Oh, clearly I had nothing to do with the measles. Not only that,
Mr. Kennedy,
Senator, not only that, if you let me finish, Senator.
You have had some time.
If you let me finish, Senator, if you let me finish, there are 83 people died when the tissue samples were sent to New Zealand. Most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior to my arrival.
I just would like to get my time back. The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
We need to move on. Senator Grassley.
Welcome. I'm going to do like I did in my office. I'm just going to make some points to you. I got about 7 I want to quickly get done. And then at the end, I'm going to ask if you disagree with anything I say and then address those things you disagree with. I'll make sure I save time for you to do that. A key responsibility of each member of Congress is oversight. Oversight allows us to hold bureaucrats accountable to the rule of law, and it helps keep faith with taxpayers. I expect HHS to provide timely and complete responses to congressional oversight. Number 2, PBMs, something you and I discussed in our office. I've been working to hold pharmacy benefit managers accountable in order to lower prescription drug prices. I expect you to work with us to hold PBMs accountable, and that may even asking your support for legislation that's before the Congress. Drug pricing. Senator Durbin and I have, for a while, been trying to get a bill passed that requires price disclosures on TV ads for prescription drugs. Knowing what something costs before buying it is just common sense. President Trump tried to do this by regulation in his first term. Vice President Vance co-sponsored our bill last Congress. I ask you to support this bill, or if you can do it by regulation.
All right, we are going to dip out of that live confirmation hearing. You've been listening to Robert Kennedy Jr. speaking there. He is Donald Trump's rather controversial pick for the job of U.S. Health Secretary. Now, during the hearing there, you heard him being challenged by a Democratic senator on his legacy of vaccine misinformation. He did, though, tell the hearing there, I am not anti-vaccine. Listening to that with me, our chief foreign editor,